How to avoid being a victim of medical malpractice. First, research your doctor. If it's not an emergency, thoroughly research a doctor before going to see them. If you are in Missouri, go to CaseNet and do research of their name to see if they have been sued. Look at their bio on their website. It will have their employment history. Do they move around a lot or change employers frequently? If so, that can be a warning sign. Where did they go to medical school? And where did they do their residency and fellowship training? If they did not do their residency training at a well-regarded institution, you may want to consider a different doctor. Look at their areas of interest or expertise on their website. Does it match what you need? Doctors are all highly specialized now. For example, if you need a hip replacement, make sure you're choosing a surgeon that lists hip replacements as their primary interest, not shoulders, elbows, and ankles. Second, review your medical records yourself as soon as possible and don't rely on the doctor or nurse to report the results to you. I cannot stress this one enough. One of the most common cases I see is test results that don't get communicated to the patient or to the patient's primary care doctor. A patient goes to the ER for something and a test is ran that shows an incidental finding that could be bad, such as cancer. Cancer is not an emergency, so the ER doctor assumes that the primary care doctor will follow up on this and doesn't say anything to the patient. The information is never sent to the primary care doctor, or the primary care doctor's office never requests the patient's records, or the patient's test results just simply slip through the cracks and the patient's condition becomes life-threatening. Anytime you have a test or a procedure, request your records as soon as possible, as soon as they're available, or go to the patient portal and review your test results. Get your records every single time and review them. You can Google the medical terms or the test results and determine whether something is abnormal. Early treatment for an abnormal condition can be life-saving, so be sure to get your records immediately after they are available. Third, make sure your doctor spends enough time explaining the risks of a surgery or procedure to you, as well as their experience. Do not let them rush you into a decision if it's not urgent. Be sure to ask them how many times have they done this surgery or procedure, what are the alternative treatments, and what complications have they experienced. Also, ask what the risks are and the known complications and what their complication rate is. Then research on Google what the accepted complication rate is. You may decide that the risks outweigh the benefits or that your doctor's complication rate is higher than the average. Finally, be sure to document everything. There's nothing illegal about recording interactions with healthcare providers in Missouri. Missouri is a one-party consent state, so you only need the permission of one person involved in the conversation to record. So if you are participating in the conversation, you count as a participating party. Recording and documenting conversations and instructions helps to avoid misunderstandings, and oftentimes healthcare providers are talking really fast, a lot of information is coming at you, and it's hard to remember everything, particularly right after surgery or when you're being discharged from the hospital. Whether they actually did or not, doctors will claim that they went over all of the risks and complications of a surgery with you. So having a recording of that conversation can be the difference in your case.